welcome again to the next episode in the Digital Mental Health Musings. And we've gone a little bit off on a more specific pathway this week, in that we have Dr. Jennifer or Jenny Connolly, who's joining us and is going to talk a little bit about digital mental health resources for alcohol misuse. So before I welcome Jenny to the conversation, I'll give you a bit of background as to where Jenny comes from. So Jenny is a clinical psychologist and also senior research fellow on the eMental Health in Practice team at QUT. And Jenny's been involved in psychology research for over 20 years, and her focus has been very much on investigating novel treatments for a range of mental health problems, including depression, psychosis, and also alcohol misuse. So she's been involved really in the last 10 years on creating and testing psychological interventions or treatments that have all been delivered via technology. So that could be by phone, online programs, apps. So that places her very well in terms of being able to talk to today's topic, which is digital mental health for alcohol misuse. So welcome. Very lengthy introduction, Jenny.
Thanks, Ruth.
So I think maybe a good starting point for today's conversation is, can you give us a little bit of background into how you came to be involved in digital resources, and specifically those for alcohol misuse?
Yeah, well, I've worked with Professor David Kavanagh for quite a number of years before he retired last year in various clinical research roles. And we've worked together on lots of different projects. And at first they started with those more traditional therapy modes, like face-to-face interventions for substance use and for craving and for comorbidity. But David was always interested in novel treatment approaches as well, and particularly ways in which we could reach large volumes of people and getting evidence-based treatments out there, making sure people weren't missing out on accessing that for a variety of mental health problems. And one of the earliest versions of that was actually a correspondence project. So we did one for depression and one for alcohol, where people were posted CBT-based work booklets. So week to week, they'd get posted a new booklet and they'd work through it. So it was a guided self-help model. And it did show positive gains for the participants. So not only did it have advantages of being able to, for people being able to receive therapy in their own homes and at any location in Australia, because they could take part from anywhere really, as long as they could receive the post. But it was part of that early work showing that self-guided CBT is not only acceptable for people, that they're willing to engage with it and that it also works. And since then, we've explored different modalities as well. So things like the internet, phone interventions and apps and combinations of those, as well as combinations of face-to-face interventions supported by phone treatment, supported by an app. And a lot of those have been programs with an alcohol focus.
Okay, so it sounds like from what you're saying, there's certainly been a growth in resources, online resources in this space.
Yeah, it has a real explosion. Yeah, and not just in Australia, there's been a lot of work overseas as well. So it has been quite well tested. Yeah, it's been out there for some time now.
That leads into what I was going to ask. When you say it's been well tested, I'm thinking there's probably a whole wealth of evidence out there around the effectiveness of these programs. Can you talk a little bit as to what that looks like?
Yeah, and there have been quite a number of reviews now and meta-analyses. So there has been quite a number of studies to the point where we're able to start combining them and looking at the effects overall. And the results are positive. So they do demonstrate that overall. So obviously some studies don't find an effect, but a lot of studies do. And when you look at all of those results, kind of pull them together and look at them overall, they are demonstrating that there is a positive effect for people using self-guided online or other digital forms of treatment for alcohol compared to, getting no treatment or treatment as usual. And those gains are seen even in programs that don't have any coaching or therapist support, so that are entirely self-guided. So, so there is a lot of evidence showing that, as I said before, not only are these modalities acceptable to clients, they're quite happy to engage with them, and they actually have lots of benefits and advantages for the clients, but they are also effective. They do actually work in helping people make positive changes.
Yeah. So I know in terms of when we were sort of talking about possibly doing this podcast conversation, we were talking about the emerging evidence showing that with our current COVID situation, more people are in lockdown or isolation, and people are reporting anecdotally, and also studies are starting to show they're starting to drink. Their alcohol levels have increased during that time. So I guess it would be useful to kind of look at this from two perspectives. One is for the listener, perhaps, who finds themselves in that situation. And then afterwards, maybe for their practitioner working with patients. So maybe we could just start with the first one of those scenarios. How can somebody find online resources useful for that, that group of people who are worried about their drinking?
Yeah, there are some good resources out there, and I think it's not surprising, really, is it, that we're seeing that trend with people, lockdown, confined to their homes. There's not much else to do, and also under experiencing quite significant pressure and stress. So it's not surprising at all. I think we could have easily and was predicted at the beginning of all of this that it would have an impact. So there probably are quite a large number of people out there starting to wonder whether things might be getting a bit out of hand and turning into a bit of a problem. And there are a number of great resources that can give information and offer online self-assessment as well. And that's a great starting point for people who are maybe starting to wonder if the drinking might be a little bit too high, or maybe they're starting to notice some negative side effects, and they might be feeling worried about that or bothered by those. And so they just want to find out more information, take stock, I guess, or do a bit of an audit. And if people often, I guess, start out asking those questions, is this typical? Is what I'm drinking, a normal amount to be drinking? How much do other people drink? How does my drinking compare to that? And how do I know if I've got a problem? How do I know at what point I should be concerned? So one great resource for, I guess, exploring some answers to those questions is counselling online. That's a great starting point. So that's at counsellingonline.org.au. And they have information that people can access that will answer some of those questions. And they also offer a service where people can email them with questions if someone had specific questions about alcohol, or actually for that website, for that service, any substance, in fact. They also have a live web chat option as well. So in live time, you can actually kind of have a web-based, conversation with someone, asking some of those questions or discussing some of your concerns. And they do also offer an online self-assessment. So people can complete that and get feedback in the moment about their drinking and whether it might be at levels that are concerning, and some recommendations for what they could potentially do about that if they were feeling concerned. So that's a great place to start if people are in those early stages of starting to worry. And something else that can be really useful, I guess, of taking stock and doing that audit is tracking drinking for a little while. It's a really good starting point, particularly in situations like this where people might not have been frequent drinkers or drinking a lot before, but are starting to find starting to have an awareness that it's increased a bit, but they may not fully understand the scope of how much. Particularly if you're, say, drinking out of a bottle of wine, it's sometimes really hard to tell how much of that bottle you've drunk. It can be very easy for that to creep up without you even really noticing. So taking stock of that can be a great starting point to work out, I guess, what is the baseline here and what am I working from? Yeah. And there is an app available that's quite helpful for doing that, called the On Track with the Right Mix. So that's an app that can just be downloaded from either app store. Of course, it can also be done the old-fashioned way with, paper and pen, or a calendar or a diary. But the app has some advantages in that it helps people track in standard drinks. And that's, I think we've all kind of heard the idea that one drink is not necessarily one drink. And so kind of learning that and tracking in standard drinks is really helpful, because it allows a much better meaningful and direct comparison to things like the recommendations by the National Health and Medical Research Council for what, safe and healthy levels of alcohol consumption are, and also for comparison against other drinkers in your age group as well, if you kind of wanted some feedback about how your drinking compares to other people. So it's important to track in standard drinks. And so an app like On Track with the Right Mix helps to provide that education and makes it really easy, because you can just choose. They have quite a lengthy menu of different types of drinks, some of the most common drinks, and once you select it, we'll record what that is in standard drinks, and also has a little section, a little nifty kind of interactive section with different drinks, and it asks you to move the line up or down to show where you think the one standard drink is within that beverage. So in a glass of wine or a glass of beer, and so it will then give you the feedback about where the standard drink is, and so it's a useful way to learn how much you're actually drinking. So if you're a wine drinker, you can kind of show, oh well, I fill my glass up this high, and that's actually 2 drinks. It's not actually 1. So it's really handy for that, and it also allows people to record how much their drinks cost, so they can track how much they're spending on their alcohol as well over time, which can be handy information when it comes to making decisions and I guess evaluating the impact that it's having. So so they're, I guess, 2 great tools as a starting point for people wanting to just take stock and thinking about maybe needing or wanting to do something about their alcohol.
Yeah. So as you're describing that, my mind's going to, they talk a lot about stages of change model. So this really is around that, when people they're sort of in the contemplation phase, the sort of planning action kind of area of really educating themselves around what's actually happening, how much are they drinking, what the cost is, which possibly could be significant. What about those people who are moving a little bit further around that model and are wanting some strategies to, help with understanding triggers, coping strategies, the sort of more sort of strategic approach to addressing.
So people who have kind of worked out, I'm not really happy with how things are, and I'd really like to make a change to it. So there are some good resources for that, and so I mentioned Counselling Online earlier, and the email and web chat that they have, and they also have some online modules that can be accessed for free, and they cover the initial steps in making a change, which are really the critical steps for people to go through. And we often find that, and research backs this up, that often that just that brief part of that beginning of the intervention is enough for most people to go on and make changes. So that those modules cover things like motivation. So looking at, what are the reasons for change? What do you gain by changing? What goals would you actually like to set? And then looking at your personal values and how all of that kind of aligns with and fits within that as well. So those modules are quite handy for someone who's ready to make a change and wanting to work out how to get started. And there's also an app called Daybreak by Hello Sunday Morning, and that's free to use and download from the app stores. And that's a community-driven resource. So it's mostly contributions by other people who are also on a journey to making changes with their drinking, and at all different stages, people who are starting out, people who are on the way, people who have kind of got there at the end. So it's a great kind of community and peer support network that's kind of recovery and change focus. So it's for people who are ready and wanting and actively trying to make a change. And there is also a professional component with care navigators who can provide extra coaching and guidance when that's needed as well. Yeah, and of course there are plenty of websites as well that might not necessarily have modules or a program, but plenty of tips and ideas for cutting back and making changes, and just to give people ideas that I can then go on and implement themselves. And exploring Head to Health is a good place to find resources like that, because they will have a list of different websites and links to different websites that have good information about alcohol and tips and ideas for making changes.
So I was going to ask, in relation to you mentioned the care navigators, because we've looked at some specific programs where they can be therapist supported. This sounds like that's not really therapist supported here. It's more a sort of support in terms of working your way around the app. Is that right?
In Daybreak?
Yeah. Sorry, in Daybreak.
Yeah, no, I think it does go a little bit beyond that when the person needs it. But the idea is more that the help, support, the advice, the ideas that they come from the community. Yeah.
It's interesting, isn't it? It's about those relationships again. And even if maybe obviously the people in that community don't know each other, they still connect in a sort of safe, anonymous way if that's what they want to do so, which is perhaps why.
Yeah, and I think there's a lot of value for people when trying to make a change, hearing from other people who have done it and the struggles that they had, and in sharing the particular things that they're struggling with, you will often come across someone who encountered a very similar issue, and what they did, hearing and learning what they did to get them through that can be really helpful as well. Yeah.
Flipping it around a little bit, what advice would you have for any practitioners or clinicians who are listening to this podcast and are thinking, they're maybe getting more referrals, they're seeing, an increased alcohol use in their patients? How would you suggest to them maybe looking at incorporating these tools?
Digital mental health tools offer a really great option for practitioners, say, who might be seeing someone for treatment or support of a particular issue. And there might be a second issue like alcohol use, but potentially there's not enough time within the sessions, or maybe it's not, the primary focus, it's kind of seen as a secondary issue. Or maybe there might be times as well when a practitioner maybe doesn't have a lot of experience with treating alcohol, and so they don't really have the confidence or feel comfortable addressing it either. And digital mental health gives a great option for kind of supporting those situations. So clients can be referred to digital mental health tools for alcohol to get assistance alongside and in parallel with getting their, the treatment from the practitioner. And that's not to say they use it necessarily in isolation. We still recommend the practitioner check in how they're going and their progress, and offer support when needed. But the client can be kind of working through it on their own, alongside the sessions, and that way the sessions can be focused on whatever the other, primary or main focus might be. So that's one way that digital mental health for alcohol can kind of be used alongside treatment. And there is a fact sheet on the eMHPrac website. So just at eMHPrac.org.au, in the resource library, in the fact sheet section, there's a fact sheet in there on digital mental health for addictions, and that can just be downloaded and printed out. And that can be handed out to clients, and it has a kind of a fairly comprehensive, but at the same time brief description of the different services and options that are out there. So the client can kind of troll through that and work out what they think might be useful for them, and pick something to try out. So that's a useful tool as well. And then, of course, a tracking app like On Track with the Right Mix can be useful for a practitioner who wants to maybe create a baseline of the client's drinking and then track their progress as they go through treatment. And probably the other potential use is digital mental health tools, particularly the support lines, offer a great support, crisis and support option for between sessions, or maybe if a therapist is going away on holidays or after treatment has ended. It's really useful to be able to pass on, if you need some support from someone, or you want to check in or just get a bit of advice, or you're having a down moment, struggling a bit, here's some lines that you can call, or resources that you can access to get some support when the therapist wouldn't necessarily be available. So counselling online is a great support option for that, with the email and the web chat. And there is also a national alcohol and other drug hotline that people can call. So the number for that is 1-800-250-015, and they can provide kind of some support and very basic counselling in the moment, but also then direct people to other services that can help.
Okay, so we'll put the links up underneath the podcast for all of those that you've just mentioned. But I think in essence, what it sounds like is that there is actually a whole heap of support out there for people at different stages.
Yes.
It's just knowing that they're available and how to access them, by the sounds of things.
Yeah, there is. And they're quite useful and effective.
What about resources that are available for our First Nations people? Is there much out there?
Yeah, I mean, there's more and more being developed, which is great to see. So Wellmob at wellmob.org.au is the best place to find Indigenous focused digital wellbeing resources. So there's and there are a few there. One example is Yarn Safe, and that's kind of an information hub on the Headspace website, and that gives information on a range of wellbeing topics that are relevant for Indigenous people. And one of those sections is alcohol and other drugs.
Yeah.
Another one is strongspiritstrongmind.com.au, and that has a really good alcohol information page focused and written for Indigenous people. And there's no, unfortunately, at current state, there's no Indigenous specific self-help program. Of course, the Indigenous people are welcome to access all the other services, but there's nothing being developed that's kind of developed specifically for them.
Yep.
Yet. Hopefully we'll see that one day soon. But there is the Stay Strong app, and that is designed to be delivered by clinicians that can be downloaded again from app stores. And the Stay Strong looks at areas of strength and worry in a person's life. So it's was developed for Indigenous, working with Indigenous clients, and developed in consultation with Indigenous clients. So it's quite culturally appropriate. And it looks at what are the strengths, what are the worries, what goals they might want to set to have better well-being. So it's not an alcohol specific tool, but it could certainly be used to explore the idea of making changes to alcohol if and that could be set as one of the goals if the client, you know, was concerned and wanted to do something about that. So yeah, so there is some Indigenous specific information out there, but it would be great to see more developed, yeah, in that area.
Also, just a quick point in relation to the Stay Strong app, because I think it's October, the podcast episode for then will be talking with the Stay Strong people at Menzies. So
great. Yeah.
That we've got coming up for those who are interested in learning more about Stay Strong app. I guess a handy point to sort of finish up is those top tips, you know, some final points, words of wisdom for practitioners out there listening to this who are going, yeah, I think I'd like to give this a go. What would you suggest?
Yeah, I guess my first tip is to first of all work out within your own clinical practice where you feel the gaps are, or I guess the areas where you feel like a digital resource could support you in doing your own work and or maybe even make your job a bit easier. So I guess some examples might be having a place to refer clients to for information, so you can spend a bit less time on psychoeducation within sessions. You don't have to go into quite so much detail. You can kind of refer them outside to a good website that, you know, can give them more comprehensive information, so that's saving some time in sessions. Or it might be, as I said before, needing a hotline that you can refer them to so that they can access support outside of sessions, or, you know, as we've talked about as well, the using the programs, you know, alongside sessions. So I guess so first of all, kind of work out, I guess, how could my practice be helped or improved with digital mental health? And then look to websites like Head to Health and eMHPrac to explore the options out there and which one will best fit that need for you. And it does take a bit of time to do that research initially, but once you have that knowledge, you don't need to do it again, or at least not for a long time, to check for updates, etc. But it's kind of, once it's done, it's done. And and then it kind of, the time spent, it ends up being time saved down the track. So I guess the main point is to not feel like you need to know about the whole digital mental health field and everything out there, because there's a lot and it's overwhelming. So rather than feeling like, you know, I need to be across all of it before I can use it, I guess just start with one small aspect of your practice where you think and feel, you know, could this gap or this, you know, bit of a burden be helped with a digital mental health tool, and then kind of work that bit out first, and then you can expand it from there. Yeah, I guess that's how I would suggest to practitioners to get started.
How about, I'm just going to tag an extra question on the end, what about from the perspective of identifying a consumer or a patient that this would be appropriate to use with? Is that just a conversation in session? What do you look for there?
I think most people are open to using technology, and it's so widely used. There will always be clients who don't, who aren't across it. And that's not necessarily all the older clients, although there's more of that, obviously, in the older clients where they may not necessarily have a smartphone or feel comfortable interacting with it. But even then, you can still use the digital tools with those people in giving them printouts of things, and certainly the phone lines and stuff are still, applicable and useful for them. But I guess I would suggest scoping it out with everybody. If you think it could be of potential use, I would not make assumptions about who or who may not be into it. I mean, older people are more and more interested in technology and everything that it can do, and often it's just a lack of confidence and knowledge. And if you can take the time, spend the time to actually just show them, so to I guess take away some of the fear or uncertainty around it, that they might actually be quite receptive to using it. And if they're not, that's great. That's absolutely fine as well. I mean, the whole point to digital mental health is to give people treatment options, so that, they're not limited to just that one traditional approach. There's actually a range of options that they can choose from, just, based on what suits them best. So if they choose not to take it up, that's absolutely fine. But practitioners may be surprised by the number of people who are, quite willing to give it a go.
Yeah, and I guess as well, with a lot of practitioners now delivering interventions via Zoom or telehealth.
Yeah.
Maybe it's easy to incorporate into those sessions because you can share screens.
Yeah, that's right. Yeah. Yeah, definitely.
Okay, well, I think there's some really helpful information you provided us with there, Jenny, particularly as well the actual resources and where they can be accessed. So as I said, we'll put some links up for that. Other than that, thank you very much for joining us. And thanks and bye for now.
Thanks, Ruth. Bye.